Channel 8 investigates Lincoln's overdose crisis, sponsored by Centerpoint. Healthy minds and bodies, strong communities.
And we continue our series this morning on Lincoln's overdose crisis. Last month, local officials released a health alert due to an increase in overdose cases. Here's why. 149 total overdoses so far this year at last report. That's already almost 20 more than all of last year. There's also been a 76% increase over the last 5 years. Also, 8 deaths last month alone, 9 including an unborn child. And new this morning, more information on how you can get help if you or a loved one has been dealing with addiction. Channel 8's Joseph Nasser goes behind the scenes to give you an exclusive peek at what getting help looks like.
3 million people in the country are dealing with opioid use disorder. This, according to the National Institutes of Health. It's a crisis many people need help out of. I paid a visit to Centerpoint Outpatient Clinic to see firsthand what the process looks like to get that help.
The first step, it would be talking to our front desk staff.
Have you been in services with us before?
Our front desk staff will get them connected with our crisis response team. All they have to do is fill out a new client form.
Here's a clipboard.
They'll get connected and taken back to our walk-in room.
Hi. My name is Alyssa. I'm a therapist here.
Our crisis response will sit down, meet with them, have a helping conversation.
So what brings you into Centerpoint today?
This is when the therapist and patient discuss the problem. Typical questions include,
Do you want to tell me a little bit about how long this has been going on? Have you gotten any treatment since your most recent overdose? Well, what else has been going on in regards to substance use? How are you handling day-to-day stuff?
From there, they'll talk about different treatment options, including meeting with a therapist like Alyssa, one-on-one for outpatient therapy, helping patients manage their withdrawal with medication like Suboxone, which is kind of like Nicorette for nicotine.
Usually they'll come in, if they come into the clinic and say, hey, I've been using, I want to stop using. I see individuals that need medication for mental health illnesses or substance abuse.
Or a health clinic where they can get their physical health care needs met.
We serve both the individuals in service at Centerpoint as well as the community, which gives us the opportunity to serve a lot of people who are uninsured and underinsured.
An official at Centerpoint tells me that last fiscal year, 8.1% of people seen had an opioid use disorder at Centerpoint. That's 347 people, a 26.2 increase from the previous year, making opioid use disorder Centerpoint's 10th most frequent diagnosis.
I have 2 individuals right now that are working on, tapering off. They're doing extremely well. Both are working, they've gotten jobs that they really love and, building their families.
Sometimes people are afraid. People are afraid to seek mental health services and substance use services. But it's like walking to any other clinic.
If you relapse, that happens. Just be honest, come in and tell me about it. And it doesn't mean you're going to be kicked out of the program.
If you're experiencing some mental health issues and you don't feel well, come in. It doesn't look any different like any other clinic around here.
Reporting in Lincoln, Joseph Nasser with Nebraska's trusted news source.
And don't forget, you can find all of our stories during our Investigate series on our website. Just click Lincoln's Overdose Crisis at the news drop-down bar. We'll be right back after the break.